You are a nurse at the post-operative care unit and have been taking care of the patient who came back from a surgery about half an hour ago. The client starts to be unresponsive to painful stimuli and is given naloxone as prescribed. Within 5 minutes afterward, the client is arousable and responds to the verbal commands. Then, an hour later, the patient is again having a difficulty to be aroused and with a minimal response to physical stimuli. What are the nursing interventions that nurse must take? Select all that apply. Number 1, administer oxygen. Number 2, assess respiratory rate. Number 3, initiate rapid response or code team. Number 4, notify the doctor about the patient's condition. Number 5, prepare for the second dose of naloxone. The correct answers of this question are 1, 2, 4, and 5. Any client in the post-operative period that is unresponsive to painful stimuli is likely still under the effects of the anesthesia medications. Naloxone will only temporarily reverse the effects of those opioid medications, but the half-life will wearing off in only 1 to 2 hours. Nurse should reassess the client's respiratory rate and administer oxygen for respiratory support. The healthcare provider shall be notified for the current condition of this patient, and the second dose of naloxone will be prepared and administered as prescribed. Naloxone could be prescribed as a one-time dose or a continuous drip.